we do get patients in the intensive care unit who are having head injury. And I think these are the patients, if taken care properly, there is a good outcome, but it can be bad outcome if there is any lacuna in the care. And the care in these patients starts right from the pre-hospital care. So I have with me Dr. Kapil Zirpe, who has an extensive experience in the neuro-intensive care. So Dr. Kapil, what are the problems with the pre-hospital care in our country, let's say?
Dr. Chawla, very sensitive question. I will say it is very difficult to answer at present situation, because as such in India, emergency medicine service or pre-hospital care concept is not well established. If you see, there are the few parts of the India, like a southern part of the India, or recently from the Maharashtra and Uttarakhand, they have started emergency medical services at the government level. The problem is not the only emergency medical service. There has to be the concept of the emergency medical service. There has to be the concept of the pre-hospital care management. If you see, these trauma victims, you can get it at any site, by the roadside, at any building site, or any construction site, at house. So there is no fixed location of such patients, and you can't judge the severity of the trauma. So when you are talking about the pre-hospital care management or the emergency medical service, it is not only in terms of the number of ambulances, or in terms of the skilled person, in terms of the communications, in terms of their time to reach to the nearby center. There has to be the coordination activity amongst that. So for example, if I want to pick up any patients from the nearby situation of the trauma victim, I have to decide which ambulance I will send. There are the different types of the ambulance. Few ambulances are only with the basic life supports, few ambulances are with the ACLS supports. So I have to get the first thing is what is happening at the scene. What is happening at the scene, that means how many patients I am going to pick from there. Whether it is a major four-wheeler accident or it's a two-wheeler accident, accordingly I have to have very good communications with the at site communication. Then I have to arrange the ambulance as per the situation to the site. That ambulance person should be skilled in management of these trauma victims. Now already I told you, regarding the management of pre-hospital care, there are two major concerns: hypoxia and hypotension. During transport, when you are lifting the patient from scene to the nearby emergency department, you have to maintain at priority hypotension and hypoxia. At any time during the transport, this patient should not be hypotensive or hypoxemia.